Okay, well, I want to talk about XDR TB. How does this differ from regular TB?
Okay, well, so what we term MDR TB and XDR TB, which is multi-drug resistant TB and extensively drug resistant TB, it's essentially the same TB. It's just that the bacteria, TB, has become resistant to the most common drugs that we use to treat regular TB. And that means that, so it's essentially the same disease, we just need to use different drugs to treat it, and these are not as good drugs. So it means that the treatment course is even longer again, so it's up to 2 years. It's very difficult to take these drugs, they have lots of side effects, and it's not nearly as effective. So while we can treat, cure 95% of people with normal TB, regular TB, it's less than 50% for MDR and XDR TB.
What are some of those symptoms? You said there's a lot of symptoms when people develop the resistant strains of TB. What are some of those symptoms?
Well, actually, there is no difference in symptoms at all. Okay. So it's just TB. So you can't tell if someone has MDR or XDR by looking at them clinically. They have exactly the same TB disease, so cough and all of the symptoms of TB. The only way you can tell is by doing a test in the laboratory to see whether the bug, the TB bacteria, is resistant to the drugs or not.
Is there anything currently being done to find a drug that can help people with these drug-resistant strains battle it? Or
yeah, thankfully there are a few drugs now that are coming through what we call the drug pipeline.
Yeah.
There's been a long time waiting for them.
Working.
Yes, it's been 40 years since we've had. More than 40 years since we've had a new drug for TB, which when you compare it to drugs for some of the other diseases that there are in the world, like hypertension or heart disease, where there's a new drug every few months.
Wow.
Which is how I mentioned before that TB is a neglected disease. Yeah. So there now are a few drugs, and we now need to really know how to use them most effectively to help people with drug-resistant TB. And we need to actually advance their use a bit more, because it's quite slow how to work out how they're used in clinical trials. And actually South Africa has a role to play in pushing this globally to make sure that they don't get bogged down in regulatory processes and to push them through, because there is such an urgent need and so many people are dying. When
you say that South Africa has a role to push the drugs through, what does that mean?
It means that because South Africa has a high burden. South Africa is a middle-income country, these BRICS countries. And I think it's, there's very little burden of drug-resistant TB in the wealthier nations. And this is where the pharmaceutical companies really usually look to their markets. And so actually South Africa has a role in pushing both their own regulatory authority, the Medicines Control Council, but also globally on a sort of a global stage to advocate to make the drugs available both to pharmaceutical companies and people like the World Health Organization, groups like that.
WHO, the World Health Organization, are committed to reducing deaths by TB by 2035 and diagnoses. Is South Africa moving in a direction where we can see this happening?
Well, they're certainly really ambitious targets. But I think we need ambitious targets because that's what drives commitment and resources. And certainly in South Africa, we've started along that road. So there are some promising signs, but there's a long way to go to reach those targets, certainly.
Now, are there certain communities in South Africa, certain regions in South Africa, that you see a more concentrated number of people who are affected by TB?
Not really, no. I mean, TB is throughout South Africa. I mean, there are some places where it's higher. And as I said, TB is a disease of poverty. So, but that doesn't mean that anyone can't get TB. And you certainly see a lot of TB in all sectors of society. And you see TB diagnosed in the private sector as well. And all provinces have TB and drug-resistant TB, MDR and XDR TB. So it's throughout the country, really.
In your opinion, if we were to stay in the state we are now, would we reach those very ambitious WHO goals by 2035?
Unfortunately, no. No. I think we need
work to do.
Much more radical thinking and innovation and hard work to reach them. Yeah.
Great. Helen, thank you for coming in. I look forward to see some of the research that comes out of the conference in the coming weeks, and then maybe we'll have some answers to some of the questions after that's finished.
I hope so, yes.